Good afternoon, everyone. Today I am going to present paper on topic assessment of knowledge, awareness, and behavior practice regarding eye donation among inpatient. My co-author is Dr. Professor Shweta Walia and Dr. Niharika Arya. Corneal disease are one of the primary cause of visual impairment and blindness. According to WHO, corneal blindness is the fourth leading cause of blindness globally, contributes 6%. Corneal transplantation is the most effective method for treating and restoring vision to the patient having corneal blindness. Thus, public should be made aware of the importance of eye donation. However, the knowledge of this concept varies from person to person and depends on the culture. The study of the knowledge, attitude, and willingness toward eye donation among admitted patients of the tertiary care hospital is my aim. My primary objective is to evaluate knowledge, attitudes, and willingness for eye donation and educate about eye donation. My secondary objective is to record increased number of corneal type after educating during the study period of my tertiary care hospital and to make recommendations for steps to increase corneal retrieval. My study design is cross-sectional study. My study center is NY Hospital, Indore. Inclusion criteria is all patients admitted in NY Hospital with age group of more than 18 years and those who can read and write in local language. My exclusion criteria is not willing to participate in interview and subject who is unaware about eye donation. My study period is of 3 months with sample size of 250 and requirements are subject and their consent. Pre-test is semi-structured questionnaire with questions on demographic details, awareness regarding eye donation, willingness for donation, and source of information and reasons for denying eye donations. Here is a sample of my questionnaire. My study procedure to approach all the admitted patients in MY hospital, explain the study which is going to be held, ask the subject to sign the consent for questionnaire, record the responses given by the subject in questionnaire, analyze the response, counsel and motivate the subject for corneal donation based on their responses. My results are male contribute 55.6%, maximum number 45.2% of patients were found in the age group of 80 to 40 years of the age. 60.4% were belong to Hindu religion. Only 48.4% were having knowledge of eye donation. MY hospital was the main source of knowledge for the eye donation, which is 39%. Only 30% were willing for eye donation. The reason for denying eye donation is religion or caste that doesn't permit, disfigurement, and other. Others are family opposition, hinders the last ritual, and no specific reason given by the patients. Some other study also done, but not the exact one. Some are Kumar et al. In 2012 on urban slums in Bangalore with sample size of 300. Other is Okai et al. In 2006 on OPD visit patient in Nigeria with sample size of 250. And other is Priyadarshini et al. In 2013 on adult in rural area of Bangalore with sample size of 350. The knowledge percentage show variability across the different population with the highest awareness in rural area of Bangalore and the lowest in the Nigeria. The results from our study find in the mid-range. Willingness to donate eye is consistently low across all study with the highest willingness observed in our study followed by rural area of Bangalore and lowest in urban slums in Bangalore. Source of knowledge varies significantly with rural area benefiting most from health programs and camping. Hospitals were the main common source in both Nigeria and our study, while television was the significant in urban slums. Religion and caste reason and figure of disfigurement was the significant barrier in our study conducted in Bangalore, Nigeria, and rural areas. Our study indicated a much higher proportion of other reasons for denying eye donation, suggesting lack of detailed education, awareness, and understanding. So the conclusion is, this was the first study among the admitted patient. The data underscores the complexity of eye donation awareness and willingness and influenced by social culture factor and information. This study highlights the need for improved awareness campaign, education initiative to enhance knowledge and promote positive behavior practice regarding eye donation among inpatient of tertiary care center. Such efforts are crucial for increasing the availability of the corneal tissue for transplantation and addressing the gap between supply and demand in eye banking. Thank you.
So your sample population was inpatients.
Yes, sir?
The sample population was inpatients.
Admitted patient, yes, ma'am.
Of which departments?
Of the whole hospital, which all those who are admitted in MY hospital Indore, we are counsel all those patients.
And including ophthalmology?
Ophthalmology also.
In your questionnaire there, so in the question you are asking from the patient.
Yes, sir.
So you are not asking some social question, why they don't want to donate. Because somebody is, they are saying that in next birth they will born without the eyes.
Yes,
Or
sir.
so why they don't want to donate and why?
Whenever I approach the patient, my first question is whether they know about eye donation or not. So if they said no, so this is my exclusion criteria. I will exclude those patients and I will counsel them what are they, why they are not, first whether they are not know, but I will tell them what is that this is not the whole eyeball I will take out, only the thin transparent sheet I will take out like this. Then still they are denying, then I will ask for ki why, what is the reason you are not allowing. So some people usually their families like caste in Muslim people they don't allow. Some people think in next birth they will not get eyes like this, and some people is like they don't want to without any specific reason.
Was it an open-ended questionnaire?
Yes, ma'am.
It's a good study, so
Yes.
it's required.
Thank you, ma'am.